Good afternoon. This is our second live Facebook presentation to hopefully answer any questions you may have. Thank you for your feedback over the last session. I had a number of questions that I hope you've all managed to get the answers for. I posted the birth afterthoughts information and the update on screening. So hopefully you got the answers to your questions from that perspective. I hope everybody's enjoying the nice weather and is managing to still self-distance. And hopefully we'll have some questions coming through soon. Claire, I think you were joining us and you had some questions for us. So I've had a message from Christina. You put that there's lots of conflicting information about partners' right to stay with mothers and babies after birth. Please confirm the rules to the JR and whether any discretion may be applied. Christina, we are, wherever you birth your baby, we are encouraging partners to stay with you during labour and for the birth of your baby. And then when you are transferred to the postnatal ward or into the room if it's on the Spires or into the room if it's in Wallingford or in the Horton, then your partner would go home from there. Obviously, if there are events in labour where things haven't gone according to plan and you need a little bit more support, we would probably keep you in the birth area a bit longer so that your partner could stay with you at that time. But we're unable to support partners being up in the levels in the John Radcliffe Hospital in the antenatal or postnatal ward. Laura, you've asked at what point do I go to hospital? During my contractions, are you wanting to use the birthing pool? Laura, our advice generally is if this is your first baby, when your contractions are regular, and that's at the point you can almost set your watch by them. So each one is as strong as the last one. They're recurrently happening every 3 minutes, would be the time to call the hospital or wherever you're planning to birth your baby and arrange to be reviewed by the midwife. If you are on your second or subsequent baby, then we would recommend that it's when you're contracting regularly every 5 minutes. But you can always phone us for advice. We're more than happy to answer your call and advise you what's the best thing to do. Ella Rose, you're 36 and 5 weeks pregnant with your first baby and you haven't discussed where you'd like to go to birth your baby. And you want to know sort of what your options are. Ella Rose, there's some good films, well, hopefully they're good films, on our website. If you go into the labour and birth pages, there's a film on home birth and there's a film on midwifery-led units, which will hopefully answer your questions. Generally, if you are otherwise well and you're considered to have a low-risk pregnancy, or if you've been seen by your obstetrician during pregnancy and they felt that actually you could have a low-risk birth, then we'd recommend that you birth in one of our freestanding midwifery-led units or in the Spires for your first baby. And if you're having your second and subsequent baby, then obviously home birth, one of our freestanding units or the Spires. You can have a home birth for your first baby. It's just that there's slightly more risk to the baby having a home birth. Again, the risk is very, very small, but it's just slightly more for people having their first baby. But the choice is really yours. And if you're considered to have a more high-risk pregnancy, then talk to your midwife about what your options are. So a message from Nicola, you're 40 weeks on Wednesday. And you've asked, will me and my partner be tested for coronavirus even if we have no symptoms? No, we won't test you. We'll only test people if we think that they have symptoms. And because hopefully you have been self-isolating in the weeks coming up to the birth, then you will be at low risk of having complications. And you don't need to leave any earlier than normal. So please do, early labour and birth, the best place to be is at home where you have more distractions. You can eat and drink when you want. You can rest without disruptions. So really being at home in the early stages of labour is the best place to be. So Fiona, you're 40 weeks pregnant on Wednesday. And you're not having a 40-week appointment, but being told that you can have a stretch and sweep at 41 weeks. What happens if it doesn't work? Fiona, when you see your midwife at 41 weeks, she will offer you a stretch and sweep. She will discuss that with you. And if you haven't gone into labour from then, she will book a date for induction of labour for you. She'll talk to you about the induction of labour process and whether you're happy to go ahead with the induction, in which case you'll be given a date, or she'll talk to you about an alternative plan if you choose not to be induced. So there's a message saying you want to know about midwifery-led units 2, and I think that's in response to Christina's message. What is the official advice for mothers who have young children at home and under normal circumstances had arranged for a family member outside the home to come and care for them whilst they attend hospital for labour? Again, we're hoping that the plans that you have made for your children involve somebody who can come and look after your children, and that they have been self-isolating to reduce the risk of them having symptoms when they come to look after your children. So, even if you're planning a home birth, we ask to make sure that you have childcare arrangements in place for when you have your children, just as before. And obviously, the government talk about social distancing, but you would say that that is a circumstance where somebody has to travel to be able to come and look after your children so that you can go into hospital, because it's crucial that children aren't left home alone and have a responsible person looking after them. So that would be whether you have your baby at home, in a midwifery-led unit, or the John Radcliffe Hospital. So please do make plans for your children. So Katie, you've asked, will there be guidance on induction specific to the John Radcliffe to be updated? You're 30 weeks pregnant and worry about being alone for induction. So Katie, we're currently working on a new induction of labour pathway. We've been fortunate to do this in conjunction with our Maternity Voices partnership. We're looking at different ways of doing induction, which mean that you will be able to be in hospital for a reduced length of time, and that you'll have your partner with you for maximum support. At present, the way the induction system works, it means that when you are admitted for induction, we ask your partner to drop you off. You're in a small 4-bedded bay with a midwife, and she will answer all the questions that you would have and look after you during that time. So we appreciate that's not as good as having your partner there, but we're doing absolutely everything we can to make sure that you're supported throughout this period. And then when you go to your birth environment, whether it's the spires or whether it's the delivery suite, that's when your partner will then come and join you there. Becky, you said that you're 40 plus 2 weeks pregnant and wondering what happens with induction and whether it's still possible to give birth in the spires. So Becky, we've always been, certainly over the last few years in Oxford, committed to women, if they go into labour and they don't need to have the hormone drip as part of their labour, if they were planning to birth on the spires, then we still support them going to birth there. So we have seen an increase in women going there from the induction of labour suite, and it's kind of become the norm. So hopefully our aim is to get you into labour without needing the hormone drip. However, if you do need the hormone drip, it would be on delivery suite for that, because we do need to monitor baby's heart rate all the time with the hormone drip. Gemma, you put what, as partners won't be able to visit on the postnatal ward, what happens if we run out of clothes, pads, etc.? Can someone drop things off for us? Of course, Gemma. You know, we're hoping that people will be on the wards for a minimum amount of time, and that hopefully you will have enough stuff with you. But obviously, if you do run out of things, we can arrange for somebody to drop things off, and we can get that up to you. So Kelly, you put about when you're in labour with your first, you couldn't move, you even had to drink from a straw, and you want to be more active so you can walk around. I think, you know, we want you to be as active as possible. Like I said last week, we've been fortunate if you're on our delivery suite and you need continuous monitoring of baby's heart rate. We did have some monitors delivered so that there's one for each room that are wireless and waterproof. They enable you to be upright and as mobile as possible. We have mats, bean bags, balls, birthing stools available in all our birth environments, whether in the midwifery-led units or on delivery suite. And we will do everything we can to keep you as mobile as possible. If you have an epidural, our practice development team have been doing some work with the midwives to try and get women up and walking about more in labour with an epidural. So we're trying everything we can to keep you as upright and mobile as possible. And what you can do at home is just, we encourage you to adopt more upright positions rather than lying back on your sofa to relax in the evening. Try and straddle a dining room chair, you know, sit more upright. If you have a gym ball or birthing ball, sit on one of those. And generally just trying to keep more upright and mobile at home. You know, go for your walk once a day and keep fit. Charlotte, I read that first FaceTime video calling is not an option during the scans. You know, you want to know what's happening, you want to know the sex of your baby, and it's a shame not to get that experience. Do you think this rule can be relaxed? Charlotte, we have challenged it in Oxford and said, you know, what's the basis behind this? Is there any way that people can have this opportunity? And it's actually come from their professional body. So the radiographers have published and they've said that it can be too distracting for the ultrasonographers, and due to problems in scan departments for, you know, picking up signal and things like that, they felt it can prolong the appointment. So they're actually operating on their professional body's advice, and so it's not something that we can relax in Oxford. So I'm very, very sorry about that. We have got the agreement from our obstetricians that if you did have to see an obstetrician, you could use your phones then, but I think that's a different scenario. So we are sorry about that. Katie, you've got two questions. You have your glucose tolerance test tomorrow, and you're just wondering what the procedures are for this. Will you be around other people? Will you be safe? Yes, Katie, we're doing everything we can to make sure social distancing is still possible in the hospitals, just like many other areas are. And we're just doing, we've reduced what we're doing in terms of the glucose tolerance test so that you're not there for as long a period of time. And you're hoping for a water birth in June. Do I think it would be an option? Absolutely, Katie. I think you had a cesarean first time round, so we'd recommend that you birthed on our delivery suite, and we do have a birthing pool there. So as long as you don't have symptoms of the coronavirus, using the birthing pool is a really good option for you in labour. Amy, you're due to have your third baby in June and hoping for another birth at the Cotswold unit. My only concern is whether the ambulance services may be too stretched and whether you should choose another option. Amy, at this present time, we're working very closely with the ambulance service and looking and making sure that we have safe, that we're providing safe opportunities and choices for women. And at present, we feel that the ambulance service can cope with transfers when we're going into hospital. If nearer the time that is something that may get affected by the changes that are happening, because everything is adapting day by day, then there is the option of the Horton midwifery-led unit, which is relatively near to the Cotswold Birth Centre, and it has a separate private ambulance there, which will mean that response times aren't affected. But I still think the Cotswold Birth Centre at this period of time is a really good option. So Joe, your baby's due to give birth in May at the Spires. Is there a virtual tour of the Spires? Joe, there isn't an actual tour of the Spires, but one of the things we did over the last year is we've made a film on midwifery-led units, which you can access via our maternity website in the labour and birth section, and you get to see quite a bit of the Spires and quite a few of the staff there, as well as the staff from the other midwifery-led units. But if you look out for the big red poppies, those are the rooms on the Spires. So it will give you a bit of an idea. It also shows you our housekeeper and the entry into the Spires so that you can see where you're coming to. And Naomi, you've got a midwife appointment on Wednesday when you'll be 38 weeks pregnant, and you've asked about a stretch and sweep. Naomi, at present our guidelines are to offer a stretch and sweep when you're 41 weeks pregnant. So that is the main sort of option for you. If you have, you can discuss with your midwife at the 38-week appointment. It will obviously just depend on how everything is progressing in terms of time-wise and what your midwife has the capacity to do. But generally, our rule of thumb is that they will do it when you're 41 weeks pregnant. Rebecca, you've asked, are home births still going ahead as per last week? Absolutely. We are passionate about being able to offer this service, and there's certainly been no changes that I'm aware of that mean that that is not an option. Julia, excuse me till I scroll down. You're hoping some of these issues will be resolved by the time you give birth in the summer. Oh, we completely agree. We would love this to be better too. But you will have a doula at home during your home birth. Will that mean that no one can come to help me? And my husband will not be able to be my birth partner as he's looking after the children. This will be my 4th home birth, but I really don't want a free birth. I feel like I'll be forced into it by the guidance that's still in place. So Julia, I think it comes down to what we're desperately trying to do in maternity is still be able to provide a good range of service for everyone. And what we did is we made the decision that we have to reduce birth partners to just one per each birth environment. And that's about reducing the exposure of you to us and us to you. So that we all stay as healthy as possible. So it's a bit like operating social distancing within a service where we have to come in closer proximity to you. If you're planning to have a home birth, the community midwife is coming out to see you at home. And what you have to bear in mind is, although the community midwife is taking many measures to reduce any chance of cross spread, of disease is she is seeing lots of other women in face-to-face appointments, and she's coming into your home. So what she doesn't want to do is she doesn't want to be bringing an increased risk to you. And also, if you have different people coming into your home, and it's particularly a doula who may have been at other people's births, she doesn't want to put you at risk and her at risk of potentially then taking the infection into when she continues her antenatal checkups or postnatal checkups the following day. So we are trying to say to people, please just have one birth partner in that birth environment. And if it is your doula that is the main birth partner that you want to have, and your partner is going to be in the other, in the rest of the house with the children, then please, do you have the reassurance that your doula has self-isolated for your birth in the 2 weeks running up to your birth? Because that's the really important bit for reducing the risk of spread. So I get that this is really, really difficult for people having a home birth. And you think it's your house, you can have as many people as you want, and of course you can. But we ask you to respect the social distancing that the government are talking about, to respect the midwives, trying to keep them safe, you safe, and the other women that they look after safe. So whilst this is very, very difficult for you, it's very, very difficult for everyone, even birthing in the hospital and being left in the postnatal ward in hospital without their partners there with them as well. We don't want you to free birth. We think it's really important for you to have a midwife present at the birth. We've done a lot of training so that we have the right skills and experience to help you, and we hope that that will, you will benefit from our skills. But we absolutely appreciate these are difficult times. And, I have suggested to other people, perhaps your doula does the support via FaceTime so that they can still be very much there for you and guiding you. It's a bit different, they can't have their hands on, but I'm not sure whether you're saying your doula would be your main birth partner and your partner would be in the rest of the house with your children. But we please ask you to respect our midwives and to try to reduce the risk of infection so that we can get through this as soon as possible and not be doing this for many months to come. Sandra, if we give birth at Wallingford and need transferring to the JR for stitches, will baby go with mum or stay with dad? Sandra, we always transfer with mum with baby. If mum has to transfer, quite often mum goes in one ambulance and the baby comes in the other, or if it can go together, the ambulance team will advise us. But yeah, I mean, midwives at Wallingford can do the majority of the stitches there. So there's just some things they have to transfer for. But generally mum goes with baby, or mum and baby go together. Laura, I've just fast forwarded past there, sorry. You've asked, if I'm having a water birth in the spires and I feel like I need more pain relief and go down for an epidural, would this mean I stay downstairs? So yes, Laura, you would go downstairs for your epidural and your birth partner would go with you. And then at the point after you've had your baby, we try to get women to go back up to the spires into the rooms up there for their postnatal stay, unless they've had to go to theatre, in which case they go up to level 5. And it's at that point that when you would go off for your postnatal stay that your partner would then go home. Jess, you've asked, is the spire still working at full capacity? Jess, to my knowledge, it is. I don't know if you can see from my background, but I have been at home for the last 2 weeks because my daughter and I have had coronavirus. So I get to go back to work tomorrow, which is fantastic. And I will know much more about what's happening when I get back. But the daily meetings that we have virtually all indicate that we are still continuing to run a full service. Fiona, you've said that you're 40 weeks on Wednesday. and have been told that you'll have a stretch and sweep at 41 weeks. What if it doesn't work? I think I've answered this already, Fiona. Somebody else had a similar query. They will talk to you when you go for your antenatal appointment about what happens next, but generally we offer you a date for induction when you're 42 weeks pregnant, and they'll have a discussion with you about what the induction involves, and you can either choose to go ahead with the induction or choose for a more conservative approach where we might be able to offer you some other monitoring. Katie, you've heard that home births are being discouraged or cancelled in some areas of the country. Could this be a risk with MLU births? Katie, we are doing everything we can to still maintain a full service. We did have 4 freestanding midwifery-led units in Oxfordshire, at Wallingford, Wantage, Cotswold Birth Centre and the Horton. Sadly, on Friday, we had to close Wantage to births. It's still open for antenatal and postnatal care, but we had to close it to births due to extreme staffing problems. And I presume if we have more extreme staffing problems, then it may affect other services, but we will do everything we can to at least have midwifery-led units available in the north and south and at the spires. But even Wantage, we're looking at on a regular basis to see whether, if staffing improves, if people can come back to work, that we could open it again. So we are doing everything we can to maintain that and keep it open. Tally, you're under consultant care because you had a complication at the beginning of your pregnancy. But actually when they were measuring your baby, they thought baby might be quite large. And at the 36-week scan, they would look at more options. And you want to know if the 36-week scan is being cancelled at the John Radcliffe. Tally, every 36-week scan is being looked at to see which ones we need to continue with and which ones we need to cancel. So ones that we have a clear indication that would inform our plans for the birth of the baby would be ones that would continue, and ones that we would consider to be low risk would be ones that we would cancel. So it's not an absolute that all 36-week scans are being cancelled. Some people are on growth scan pathway D, and their scan will definitely happen. And there are other scans that might have to happen, but it's just, you will be contacted. If you have a date for your 36-week scan, if they're going to cancel it, they will contact you to arrange it and explain why. Emily. So you've seen the RCOG guidelines updated yesterday to suggest that if labour hasn't started by 41 weeks, mothers should be automatically booked in for induction at 41 plus 2 or 3 with no community midwife appointment at 41 weeks. Will this be the case at Oxford? Emily, this isn't the pathway that we're following at present. It's something that we have been looking at more long term in terms of changing the date for induction, but it's not something that that we are doing at present. So at present, our pathway is as the same as normal. We have defined criteria for people being induced, and induction for post dates for no other reason is at 42 weeks. Natalie, if I birth at the Horton but need to be transferred to the John Radcliffe, will birth partners be able to come? So Natalie, if you birth if you birth at the Horton and are then transferred postnatally, then birth partners wouldn't be able to come with you because we haven't got capacity for them to go up to the postnatal ward. So it would just be you and the baby that were transferred to hospital. If you were obviously transferred during labour before the birth of the baby, then your birth partner would be able to come with you. It all comes down to having to reduce people going up onto the levels in the hospital. Sophie, hi Sophie, we've met already. When I come for my induction, should my husband sit in the car or go home? Sophie, I think when you are coming for your induction, if your induction is going to take time and you are on your baby 1 or baby 2 or baby 3, then it would be fine for your husband to go home and wait, because it will take some time. If this is your 4th baby that you're having, you would go onto our delivery suite, and then your partner would come in with you. So if you're going onto our delivery suite to have your induction, then partners would come in with you. But if you're going to our induction of labour bay, which is on level 6, then we would ask that your partners go home and wait, because it will take some time. It will be at least 6 hours generally before you would be ready to go to delivery suite or the spires. Nicola, you've said this is your 3rd baby, and if all goes well and you and the baby are okay after birth, will you be able to go straight home with your partner? Yes, Nicola, that is fantastic. We want to encourage more and more people to go home. We would ask that you make sure that you have the baby's car seat with you when you come up, because we wouldn't be able to discharge you if you didn't have the car seat. So as long as you have the car seat with you, then you can all go home together. Rachel, you're 32 weeks pregnant with twins, and you want to use the birthing pool for pain relief in labour. Rachel, we do have wireless and waterproof monitoring for twins, and this should be an option. If you want to discuss it with your midwife, and if you want to discuss things with me further, then they'll arrange for me to contact you by phone and arrange a plan for you, because it can be a little bit different when you're having twins. Katie, when you had your first baby, you gave birth in the spires and had a 3rd degree tear. And then with your second, you went to delivery suite because you had gestational diabetes, but you only had a 2nd degree tear. I'm hoping for Wallingford or Spires birth for my 3rd baby. Will I be able to actually give birth in water, as I didn't have a 3rd degree tear last time? Katie, yes, if you want to birth in water in the pool, that's absolutely fine. Some people, when they've had a bigger tear, like to be out of the water and have the midwife have her hand more actively there, helping to reduce the chance of having a tear. But if you would like to birth in the pool without that, then again, that's your choice. But great. We're happy for you to birth in the spires or in one of our freestanding midwifery-led units. Katie, you've said, will there be any extra capacity made available at the John Radcliffe or midwifery-led units if home births are likely to be decreasing? Katie, it's not our experience that our home births are decreasing. It's still a service that we're offering. And so, you know, we're happy for people who meet the criteria to birth at home or in midwifery-led units. And that tends to be what we want for the most suitable women, so that women who are at high risk would birth on the consultant-led unit, and everyone that's low risk would birth at home or in our midwifery-led units. Meg, will student midwives still be in attendance of births in any environment? Meg, I'm not completely up to date with where the students are at present, and so I will update you on that. I think there are still students in practice at the minute, and so I will update you like I did the last time about what's happening with students after today, unless Sasha's on and wants to answer that question. Becca, so sorry if already been asked, with the antenatal classes have been cancelled, is there or will there be virtual online classes? Becca, I am really pleased to let you know that I spoke to our Director of Midwifery this morning about this very thing, and we are hoping that we will be able to offer, like I'm doing a Facebook Live, that we'll be able to offer the same in terms of some antenatal classes, and hopefully then, because they're live and available, people can see them if they miss out on actually being part of it. So watch this space in terms of the Oxford Maternity Voices Partnership Facebook page, and hopefully we'll have some more information on that by the end of the week. Joanna, will there be a reduction in anaesthetic cover for epidurals for maternity cases? Joanna, I think people are concerned that our anaesthetists will have to go and work in the general side. But from today we have set up a resident on call for our consultants, so that they're available in the hospital more to help with the service. So we are doing everything we can to maintain a normal service at present. Jess, you've asked if there is a new antenatal appointment pathway for Oxfordshire, and yes, there is. You're currently 32 weeks pregnant, so wondering what appointments will be face-to-face from now on. Jess, we have a number of people making phone calls to tell women what is happening in their area, because it depends whether this is your first baby or your second and subsequent baby, how many face-to-face appointments that you'll have. We are following the Royal College of Obstetricians and Gynecologists advice. So I think we put an attachment for that on our website so that you can have a look at that. But your community midwife will talk through the pathway. It was finalised on Friday afternoon and is in place from today. So please have a look for people will be phoning you to update you on what's going to happen now for each stage of your pregnancy. Becca, you're 38 weeks pregnant and you're booked to have a caesarean section in 2 weeks. At what point can my partner come in? I've been told I won't be seen by midwife prior to the caesarean section. Hold on 2 seconds. Sorry, I've just had to change screen. So I understand some examinations will need to be performed before. So what will happen is that your partner will come in with you on the day of your caesarean section, and you will be contacted by the anaesthetic team to arrange what will happen in terms of your pre-op appointments. Oh, that did not help. Sorry if you lost me. My computer decided to act up. Got to love technology. No, I can't see your questions. Oh, I can now. Victoria, you're due for a planned caesarean 2. Barring any complications, when would I be able to go home? I'm trying not to pack too much stuff in my hospital bag. Excellent. Victoria, we are asking people not to pack too much stuff in their hospital bags, because obviously when you leave hospital, we have to help you with the baby and everything to go back to meet your partner to go home. We are hoping if you have a caesarean section one day that you will go home from hospital the following day. So we're trying to reduce your time in hospital as much as possible. Rebecca, you've asked about whether your midwife appointments are going to continue at your doctor's surgery. Some doctors' surgeries aren't open anymore, and we're having to use other venues, such as our midwifery-led units. If you are not contacted by one of our midwives beforehand to make alternative arrangements, then we ask people to go ahead with what their original plan was, because some GP surgeries are still yet letting us use their rooms and other GPs aren't. Jessica, you've asked if the 36-week scan will be reintroduced once this is over. I think it very probably will be reintroduced when it's over, but we will be using this opportunity for us to look at the services that we are providing to make sure that we're providing the right services. Excuse me. Christina, if a mother is discharged before her baby, if the baby goes to special care, will the mother and or father be able to visit or stay with the baby? Yes, Christina, I'm not entirely sure what the neonatal unit pathway is, but I'm pretty sure that parents will still be able to visit their mothers. But the mothers and fathers will still be able to visit their babies. But again, I can ask that information and post that for you if it's something that you know that you have a baby who is more likely to go to special care. Nicola, you've asked about newborn checks being completed in the hospital before discharge. Yes, we are trying to do that to make sure that the newborn examination takes place before you go home, or that we have clinics set up where it can happen. So it is a requirement for you to have the newborn check, and we will make sure that that is completed. Rebecca, again, you've talked about the 36-week scan being cancelled. You haven't been made aware of it. As I've said, it's done on a case-by-case basis. Some 36-week scans have to go ahead, whereas others might have to be cancelled. Gemma, are we still doing home births? Yes, we are. At present, that's still taking place. And Prem, you've said your 38-week appointment was cancelled. And the reason for that is that they've changed from seeing as GPs to their place. Should I be concerned? No, Prem, we've looked at all of our services that we provide and our pathways, and we are doing care at the right times to make sure that we see people and make sure that mum and baby are well. So please don't be concerned, and you will have your appointment going forward. Thank you very much for the positive comments that I've received from everybody. I hope that you have found this to be helpful. We will be doing another session on Wednesday, and hopefully doing that from within the hospital. So I'm going to try and have, if I can pin down some of our midwifery staff so that you can see some faces and hopefully reassure you that we're still running as normal. And the things I'm going to update you on afterwards are what's happening with students at the minute, and the questions about access to the babies in the neonatal unit. And as I said, later this week, please look out for our live antenatal classes. So thank you very much. I'm going to end this for today because I don't think there's any more questions. Oh, there is. Just sneaking in another one, Katie. If further midwifery-led units need to close like Wantage, is there a plan for increasing capacity at the JR or perhaps the Horton? Katie, we are still hoping to keep midwifery-led units and home births running, so we don't feel we need to increase capacity because we have capacity within the units as they are. All of our midwifery-led units are underutilised. We have space for more births there, but obviously with midwifery-led units, we do say it's about the right women giving birth in the right place. So if you have a normal, low-risk pregnancy, birthing in a midwifery-led unit is as safe for you as birthing in the hospital and is a really good option. So for community births, absolutely, talk to your midwives about it. So it's really great to have this opportunity to chat to you all today. I hope you have a nice day and don't go out too much and enjoy the sunshine, but make sure you have your walk and get some fresh air. Take care now. Bye.